1. In the TNCC course, which adult learning principle most effectively supports trauma nurses in applying airway management skills? A. Rote memorization of textbook content. B. Experiential scenario-based simulations. C. Independent reading without practice. D. Passive listening to lectures. 2. Which evaluation method best determines whether TNCC learners can correctly apply the primary survey sequence? A. Written multiple choice test. B. Instructor observation during a simulated trauma scenario. C. Peer discussion group reflections. D. Post-course online survey. 3. When designing TNCC curriculum, which element should be prioritized to ensure skill mastery? A. Clear objectives linked to evidence-based trauma protocols. B. Instructor preferences for teaching style. C. Learners' requests for entertainment-based activities. D. Randomized topic order without sequencing. 4. A learner struggles with secondary survey assessment steps. What is the most effective instructional intervention? A. Repeat the entire lecture without feedback. B. Provide guided practice with real-time correction. C. Allow learner to skip the survey step. D. Assign independent textbook reading only. 5. Which communication technique ensures clarity when explaining Glasgow Coma Scale (GCS) scoring to adult learners? A. Use lengthy theoretical explanations. B. Demonstrate scoring with case examples. C. Provide only written handouts. D. Avoid answering learner questions. 6. During TNCC practical evaluation, what best ensures objectivity? A. Standardized checklists based on ENA criteria. B. Instructor's personal opinion. C. Peer impressions of performance. D. Student self-assessment. 7. Which regulatory standard most influences the structure of the TNCC program? A. Emergency Nurses Association (ENA) guidelines. B. Individual hospital preferences. C. Learners' anecdotal experiences. D. Instructor-developed protocols only. 8. When teaching older adult nurses, what adjustment supports effective TNCC curriculum delivery? A. Allow for slower pacing and frequent reinforcement. B. Exclude them from skill stations. C. Increase lecture length and complexity. D. Provide minimal practice opportunities. 9. How should a TNCC instructor mentor a novice facilitator during their first course delivery? A. Offer constructive feedback after observing teaching segments. B. Avoid feedback until the course is completed. C. Focus only on negative performance elements. D. Let them teach without observation or guidance. 10. Which adult learning principle underpins the TNCC use of trauma scenarios? A. Adults learn best through application of real-world experiences. B. Adults prefer theory without practice. C. Adults are motivated by passive information delivery. 11. When a learner incorrectly performs cervical spine stabilization, the instructor's best action is A. Stop the skill, demonstrate correctly, and allow retry. B. Ignore errors to avoid embarrassment. C. Provide only written correction after class. D. Disqualify the learner immediately. 12. Which evaluation strategy best identifies gaps in learner competence during TNCC? A. Formative assessments during hands-on practice. B. Summative exam only at course completion. C. Learner enjoyment surveys. D. Informal peer feedback. 13. A TNCC curriculum must include which essential design feature? A. Sequenced modules that align with trauma assessment priorities. E. Instructor discretion for random order. C. Exclusion of skill practice to save time. D. Emphasis only on rare trauma cases. 14. A nurse expresses frustration about memorizing trauma algorithms. What instructional strategy supports retention? A. Link algorithms to case-based practice scenarios. B. Repeat algorithm verbally without context. C. Encourage the nurse to self-study only. D. Reduce testing requirements. 15. What is the primary role of communication in trauma nursing education? A. Ensuring accurate transfer of time-sensitive, critical knowledge. B. Entertaining learners with complex stories. C. Limiting discussions to avoid delays. D. Focusing solely on theory without practice. 16. Which formative evaluation method best aligns with TNCC objectives? A. Real-time performance feedback during simulated trauma resuscitations. B. Post-course written reflections only. C. End-of-course summative test. D. Peer surveys about teaching style. 17. A TNCC instructor must accommodate learners with diverse clinical experience. Which strategy is best? A. Tailor scenarios to challenge both novice and advanced nurses. B. Design scenarios only for expert-level learners. C. Lower standards for novice participants. D. Avoid diverse grouping in skill sessions. 18. What is the mentor's ethical responsibility when guiding a new TNCC instructor? A. Provide timely feedback while modeling professionalism. B. Criticize publicly to highlight mistakes. C. Withhold teaching resources to test resilience. D. Ignore questions to promote independence. 19. Which evaluation tool is most reliable for TNCC competency validation? A. Standardized performance-based checklists. B. Instructor memory of learned actions. C. Peer feedback without criteria. D. Self-scoring by the learner. 20. Which adult learning concept supports the TNCC use of reflective debriefing? A. Learners consolidate knowledge by analyzing past experiences. B. Learners prefer no review of errors. C. Learners gain more from repetitive drills alone. D. Learners avoid discussing emotions in clinical scenarios. 21. Which method best ensures accurate teaching of hemorrhage control skills? A. Demonstration followed by supervised return demonstration. B. Reading from a manual only. C. Group discussion without practice. D. Assigning independent research. 22. What communication behavior most enhances learner confidence during skill practice? A. Provide specific constructive feedback that highlights strengths. B. Deliver only negative criticism. C. Withhold all feedback until final exam. D. Focus on group performance, not individuals. 23. Which regulatory compliance issue is mandatory for TNCC courses? A. Alignment with ENA's standardized curriculum. B. Instructor-created local rules only. C. Informal peer-developed objectives. D. Hospital-based shortcuts without ENA approval. 24. How should TNCC curriculum be structured to maximize learning outcomes? A. Progressive, skill-based sequencing aligned with trauma priorities. B. Random, unconnected lectures. C. Immediate emphasis on rare complications. D. Exclusion of primary survey training. 25. What motivational strategy supports adult nurses struggling to stay engaged? A. Relate skills directly to patient outcomes in trauma cases. B. Offer unrelated incentives without context. C. Minimize practice requirements. D. Eliminate testing to reduce stress. 26. Which mentoring practice is most consistent with professional TNCC standards? A. Provide consistent guidance, support, and constructive critique. B. Allow new instructors to fail without support. C. Criticize only in front of learners. D. Avoid formal mentoring relationships. 27. Why is reflective practice critical for TNCC instructors? A. It enables continuous improvement in teaching and assessment. B. It discourages learner feedback. C. It promotes avoiding course evaluation. D. It reduces accountability. 28. Which communication method best supports kinesthetic learners in TNCC? A. Hands-on practice with immediate correction. B. Long lectures without interaction. C. Written guidelines only. D. Video-based theory with no practice. 29. When a learner repeatedly makes errors in airway assessment, the instructor should A. Provide stepwise demonstration and corrective practice. B. Ignore errors to maintain session flow. C. Let peers provide unsupervised feedback. D. Delay correction until final assessment. 30. Which adult learning principle supports learner autonomy in TNCC? A. Self-directed learning through guided scenarios. B. Authority-based, rote learning only. C. Memorization without application. D. Instructor-dominated lectures. 31. Why is co-teaching valuable in TNCC instructor mentoring? It allows new instructors to practice with guidance and immediate feedback. B. It eliminates need for supervision. C. It avoids learner exposure to errors. D. It replaces scenario-based learning.